My name is Lori Malco, and welcome to Never Alone. Never Alone is a faith-based ministry that was just kind of started by me as a nurse for 42 years, involved recently coming into a field of working with mental health patients, realizing the need of the people needing spiritual counseling and coming alongside of them and Christ-centered in what I do. We are having a professional speaker there. No always are faith-based in their walk with that. So our professional speakers usually once a month will come forward and they'll have a targeted topic. And so our ministry focuses on education, awareness, and resources for those struggling with mental illness. And you know what? Everybody struggles with something. And so we're all in this together and we're all trying to get resources out to help people so that they can take this walk and be able to have a little bit more confidence that you're never alone. So we're really blessed today to be able to have a wonderful guest speaker, Erin Ashcraft. She's a LMFT. She's she's a professional specialist in. She works a lot with anxiety and panic disorders, and she's a compassionate approach with many years of clinical experience. We're really excited to have her come forward and give us a really great understanding about anxiety and panic disorders. Thank you, Erin.
Thank you, Lori. I found it funny that Lori's like, no anxiety, because even though I'm a professional, right now I'm dealing with some anxiety. Here I am with a racing heart. Public speaking was never one of my favorite things, but I found it to be a challenge of one way, like exposure to right? One way to overcome things is to so I actually find it kind of nice to be able to just be vulnerable and be, hey, right now my heart is racing, but I'm excited to be here. So, about myself, I'm a licensed marriage and family therapist. My road to becoming a therapist resulted in my own experiences as well as trauma, panic disorder, anxiety, depression, all that stuff that led me down the road to, because of the trauma I experienced, I actually found myself afraid to go into therapy. I was afraid of like judgment. And all my experiences of when I did reach out for help wasn't helpful. It was just more re-traumatizing experiences. So I decided I'm going to figure out what's wrong with me and go from there. That brought me to my first degree in psychology with a focus in crisis counseling. And then eventually down the road, I went to family therapy specializing in trauma. And then today I'm presenting on anxiety and panic disorder, evidence-based understanding and support. There we go. The overview for tonight is we're going to start with kind of like the definitions and the types of anxiety and panic disorder. We're going to do a deep dive with GAD, or general anxiety disorder and panic disorder, and the neurobiology of these disorders, the risk and diagnostic criteria, interventions and treatment. And then there'll be a case example and throughout the night I might throw in there some of the experiences I myself have had and with other clients and things that were helpful to help them in their healing journey. And then we'll have some question and answers. So what is anxiety? It's actually a normal human emotion. And it stems from our basic need for survival. So it's meant to alert us to potential danger. However, when anxiety becomes chronic, overwhelming, or disconnected from real threats, it becomes what we call maladaptive. So we adapt in like a way that's more harmful than helpful. It adapts in a way our central nervous system is not supposed to or was created to operate. So the key difference between fear and anxiety is timing. So fear is like a response to immediate threat. Anxiety is more future focused and it's often more vague. So when I was first asked to come here to present, right away I'm like, yeah, that's awesome. And as the day got closer, I started getting the butterflies in the stomach and heart started racing a little bit. So that was my fear response. Well, I used that for good. I used that fear to motivate me to make sure I got my stuff done, make sure my presentation was done. But then when it turned into thoughts of, oh, I don't know if I can do this, I'm gonna fail, what are people gonna think? I had to use all my skills as a therapist to know that's a negative thought, that's maladaptive, I can do this, it'll be great. And that helped me get through be here today. So that's the difference between the anxiety and fear. We also want our anxiety to kick in if you're faced with a threat, like you kill a bear. We want our adrenaline going. We want to be able to run from that bear. So it's important to have experienced anxiety, and I always tell my clients, we're not going to completely get rid of anxiety. We need it. How can we use it for good, for motivation, and then give them the tools and skills to cope so that they are able to kind of keep that nice balance. So the anxiety disorder spectrum includes GAD, the general anxiety disorder, panic disorder, social anxiety, separation anxiety, phobias, and agoraphobia. It affects how we think, feel, cope, and relate to others. So in order, so these outline specific anxiety disorders. Each of these disorders have a distinct criteria, but they all share a core feature of excessive worry and physiological arousal. And today we're just going to focus on the GAD and the panic disorder. So the GAD criteria, according to our lovely DSM-5, the diagnostic criteria, so this is what the APA, American Association the American Psychological Association. This is their little handy book and guide that we use to know what kind of diagnosis to give someone. So that's kind of where, even though we have all these overlapping diagnoses, is where we can break them. And the newest one is the DSM-5-TR. So this is the one before the TR that I have here. And they do a lot of updating and they change it. So the diagnostic criteria for GAD is excessive anxiety worry. It has to occur more days than not for at least 6 months. About a number of events or activities, it becomes difficult to control the worry. Anxiety and worry associated with 3 or more of the following symptoms. You might feel restlessness or feeling keyed up or on edge. You're easily fatigued, difficulty concentrating, or your mind going blank. Some people freeze and the mind goes blank as well. Irritability, muscle tension, sleep disturbances, any kind of not being able to fall asleep or staying asleep or restless. It'll cause clinically significant distress or impairment in social, occupational, or other areas of functioning. I also have to rule out that it's not due to substance use, any other kind of medical condition, or another mental disorder. Panic disorder is defined. It involves a surge of intense fear or discomfort that peaks within minutes. And according to the DSM-5, 4 or more of the listed symptoms must be present, such as a rapid heartbeat, shortness of breath, chest pain, or fear of death. Many people describe these attacks as feeling like a heart attack or losing control. It can be incredibly frightening, and even though they're not physically dangerous, criteria for diagnosis is at least experiencing that once a month. Excessive worry and that change of behavior, also ruling out other medical conditions and substance causes. So with a panic disorder, those are usually more like unexpected and they're like out of the blue. And then it becomes persistent, and a lot of times with panic disorder, the biggest fear that the person has is having another panic disorder. And so it becomes like this vicious cycle. And since it comes out of the blue, then all of a sudden I can't go to the grocery store. So what if I have a panic attack? Or what if I can't go to my child's program because I have a panic attack? I can't do my speech because then I have a panic So if it comes to interfering, you know, you're not able to do your job or just live life, then it's just defined as overwhelming, unpredictable, and debilitating. And some of the symptoms experienced palpitations, accelerated heart rate, sweating, trembling, or shaking, shortness of breath, or feeling of being smothered, feelings of choking, chest pain, discomfort, nausea, abdominal distress, dizziness, lightheadedness, or feeling faint, chills or hot flashes, numbness or tingling sensations, derealization, which means feeling detached from your surroundings, or depersonalization, feeling detached from yourself, also known as dissociation, fear of losing control or going crazy, and a fear of dying. And one thing about diagnosis, an issue I run into when working with people, you know, I have to come up with a diagnosis. Bill insurance, you have to have a diagnosis. And a lot of people, you know, don't want that tied to them. And I'm always very careful because labels aren't helpful, they're not fun, and I always tell people this is not a label, this is not who you are as a person. What it helps me do is it just helps me narrow down the list of your experiences, and I can go into my tool bag and kind of know what tool to use. Like, these are the symptoms, we can find out what's driving them, and then it helps me be able to navigate their healing journey and help them along that. Does anybody have any questions so far or anything? I'm gonna have more questions at the end, but we can do this.
Panic attack symptoms, did you get all of those at one time, or like sporadic?
In order for there to be like the diagnosis, there has to be at least 4 of them, and it has to happen at least once a month.
Okay.
So these are just some of the symptoms, and if you notice, very similar to the general anxiety disorder and panic attack, and I'm gonna pick that part a little bit as well. Anybody else have any questions? So the neurobiology of anxiety and panic disorder, I put the trauma brain in there. I specialize in trauma, so I know trauma brain. So the amygdala, that's the little blue dot there, is the brain's fear center. It plays a major role in detecting danger and triggering the stress response. So in anxiety disorders, the amygdala tends to be hyperactive. So it's constantly like fear, go, fight, freeze, on, whatever response it is for survival, right? And then you end up operating in survival mode. The hypothalamic pituitary adrenal, the HPA axis, which is a certain area of the brain with a bunch of different functions, they're all communicating together, then releases the stress hormones like cortisol and adrenaline. So that's what leads to the physical symptoms of anxiety. Well, we need those physical symptoms to give us the energy to, you know, run out of the burning building. But when these are constantly operating, hypersensitive, it's constantly like you have a cup full, constantly running on high, and then when life's little stressors come, had a flat tire, your doctor bill came, and all of a sudden your cup's overflowing, and then you're just having chronic excessive anxiety, uncontrollable, because your cup's already. So if your central nervous system is operating the way it's meant to, your cup would be down here, and then the bill comes, oh, I got the flat tire, and then you get through that, and it goes, you know, so your cup stays within the window of tolerance, and you're not overflowing with anxiety. So as Matthew said, these very similar physical responses. The best way I can explain it is GAD tends to be a top-down effect. So if we end up with like thoughts and worries, and they start ruminating, and it kind of feeds into the anxiety. Where panic disorder is more of a bottom up, when you start feeling the physical symptoms of it, and then the panic sets in because when you feel the physical symptoms, it triggers the fear of the panic attack. So it's kind of like top down or bottom up. So in generalized anxiety disorder is more like a gradual everyday, where the panic is out of the blue, kind of leaves you in a freeze response, don't want to go places. So we got the GAD, the persistent excessive worrying about a variety of areas of life. The worry occurs most days for at least 6 months. Symptoms include the fatigue, restlessness, mental tension. It's also the focus of worry is often future oriented and it's hard to control. The symptoms develop gradually, and usually you can kind of identify the stressors or life stressors kind of driving the anxiety. Or the panic is reoccurrent, it's unexpected, it's sudden, it's intense fear. It does include also the racing heart, the shortness of breath, chest pain, dizziness, that fear of dying, fear of future attacks. The symptoms are abrupt and intense. You may not have a clear trigger, it just might come out of nowhere. And the panic is more focused on the physical, so the fear of losing. Risk factors. So anxiety and panic disorders arise from a mix of genetic, biological, psychological, and environmental factors. And that's one thing, being a marriage and family therapist, we work out of a lens that's more systemic, where the LPC, social workers are focused primarily on the social environment, LPCs and other professional counselors are more like have a individualized focus, where marriage and family therapists can look at the bigger picture. So if someone comes to me, I work with a lot of individuals, but when they come to me with anxiety, I'm also looking at their relationship. This person's dealing with anxiety. Are the relationships supportive, or is it like throwing fuel on the fire? So I also look at that too, and I also look at other factors of family life history. What was their life like growing up, and so kind of like a bigger lens that we tend to look through. Individuals with a family history of anxiety are at higher risk. Early childhood trauma or chronic stress can also sensitize the nervous system. So just even growing up and experiencing trauma, or even being in a house that had a lot of anxiety, that central nervous system is still developing as a child, the brain is still developing as a child, the attachments with the parents, that can already give someone a super sensitive amygdala that they bring into their adult life. So looking at that as well. Some personality traits too, like high sensitivity or behavior inhibitions. So temperament, how a person's personality is, how do they react to like an anxious personality, like that personality, it's just part of who they are. So that also increases the vulnerability carrying one of these diagnoses and experiencing anxiety or panic. Certain medical conditions, as well as substance use, can mimic and worsen symptoms. So we also have to rule out, like, are you using drugs that might give you anxiety? Try to rule out that as well. Or they might be using drugs to cope with the anxiety. A few different other areas to look at. Differential diagnosis. A differential, just trying to distinguish between one disorder from another. And it's really important, like, for professionals to really just kind of pick apart, because like as we've been noticing, there's just a lot of similarities between all the different types of anxiety. And once again, that's important because it helps us know what kind of tools to use. So, there's just a little breakdown there for just to, if it's a panic disorder, they're having panic attacks versus persistent worry. So that would be GAD. So the social anxiety primarily relates to social judgment. So that these people with anxiety, they're scared to be out in social situations, and the anxiety is driven just from feeling like people are judging them or having, probably due to like past experiences. Obsessive compulsive disorder, intrusive thoughts with compulsive behavior. So, and that can bring some anxiety symptoms. That's also good to know if we're treating anxiety, but if there's obsessive compulsive, that's a whole different, avenue and a way to treat. Major depressive disorder. The worry can occur, but it's typically alongside a low mood and just unable to experience joy. Adjustment disorder with anxiety. That's anxiety that's tied to a specific life stressor. It's usually time limited, and a lot of times people that have the adjustment disorder with anxiety, they want like a recent, it's not chronic, like a recent incident or life event that happened. They're just really struggling with handling it, and usually, maybe 6 months of therapy as they learn tools to upgrade their coping skills and learn tools to overcome. PTSD, so there's the hypervigilance and worry that are trauma related. So once again, a lot of people like come with a trauma lens, so I'm always asking if people have traumatic experiences. A lot of anxiety comes from that. So looking for the hypervigilance and the other specific criteria that could be tied to separation anxiety disorder. That's a excessive worry about separation from attachment fears, often in children, but can persist into adulthood as well. And then the substance and medication-induced anxiety disorder or any medical conditions that can bring. I know of people who've been on medications for a medical disorder that are increasing their anxiety and don't know what's going on. I've even had people come to me. I like to look from a holistic view. Like let's look at the person from a physical aspect, like biologically. Are you low on vitamins? A lot of times people come to me and they, what's your vitamin D? If you get a chance, go to your doctor, get your vitamins, minerals checked. I've had a couple people, oh, my vitamin D is low, only in therapy for 3, 4 sessions. Once we got the vitamin D in there, they're like, oh, I'm feeling better. So just kind of looking at that as well. And then a differential diagnosis for the panic disorder. Same thing, just kind of picking those apart, trying to figure out what exactly is driving that anxiety. A lot of different avenues you can go down. And that's basically like picked apart the last one, so they'll all hear me not read it. Any questions about that differential diagnosis? Evidence-based treatment. CBT, has anybody heard of CBT? It's like the most common model that's used, has a lot of research behind it, a lot of success behind it. That's always my basis. I kind of pull from a lot of different models and theories as well, but that's CBT always offers a really good basic kind of formula that I follow when working with people. It's kind of like the gold standard for many disorders. It helps individuals identify and restructure the anxious thinking patterns and engage in exposure to fear sensations. So just working with people to recognize those patterns and try to find kind of where did that pattern come from. A lot of times it's something that developed a belief that they had as a child. And once you kind of help them sort out their experiences and kind of dig deep, like where did that belief come from? And it might be something that was put in childhood and it's still running in the background while keeping your central nervous system on high alert. And then exposure therapy, like having anxiety, but you face the fear and facing your heart process and you're feeling confident and comfortable. So that's another form of having a therapist with you while how you're being exposed or bringing up memories that create the anxiety and then working through them. Then also there's medications, SSRIs, also known as like Prozac, Zoloft, Paxil. The SNRIs can be helpful, especially when symptoms are severe. Now, as a marriage and family therapist, we don't get a whole lot of training on medications. So people tell me their medications, and sometimes I ask them, I look up what are the side effects. A lot of times I found out that people, I had someone who was struggling with gambling out of nowhere. I had been working with this person for a year. All of a sudden, she's like, I keep going on my phone, I keep gambling. I and so we're going through everything. Well, here she had started a new medication, and we pinpointed like that was the only thing that changed. Went off the medication, did gambling, was out of her mind. I researched it. That was one of the side effects. Was like addiction, like developing an addictive pattern. So it's like really weird. Like you just things you don't think of. So it just really helps when we just have this kind of information that kind of help people break down what's driving this behavior or this condition. And benzodiazepines used to suppress the central nervous system or sometimes used short term but are not recommended for long term management due to dependent risk. So a lot of times the best formula, if people do choose to decide they want to use medication, I always leave it up to the client if they're comfortable. I have some that are like, no way, and have some people like, yes, I'm going to psychiatry, I'm getting them tomorrow. It just really depends. But it's usually recommended for those to be short term if possible. Um, to just kind of bring that central nervous system down so that then you can work through the cognitive behavioral therapy. But sometimes you can't think straight when you're anxiety. So I think I've had maybe one client where I highly recommended some anxiety as like guidance and something new, natural because I just couldn't work with it. Because their anxiety is so high to just get into a place to like focus or so sometimes each person's different, what people believe about medications. It's ultimately up to the client what they're comfortable for. I've seen it help be like miraculous for people. I've seen it be a train wreck for people. So you just never know. It doesn't hurt to, try and see what happens and go from there. Adjunctive supports, which some of those handles back there, breathing, mindfulness. This is stuff to do along with if you choose medication and therapy, which should be used hand in hand. Exercise, sleep hygiene, peer support, group therapy. So a lot of times I help people in the beginning um, learn some of these support systems, just once again to bring the anxiety levels down to where we can actually work through some stuff. And then the handbook back there, I had the grounding techniques from Therapist A, which is a great free website. So just grounding techniques. Um, Lifestyle does play a key role. Grounding techniques like the 5-4-3-2-1 method that can help reduce those acute symptoms. Support groups as well. Just sometimes just being around people that understand you and get you and like, hey, I've been there, I understand. Even therapy being a space where a therapist can explain, hey, this is what your brain's doing. So that's the psychoeducation part, like that's what I'm doing tonight, is psychoeducation. When we kind of understand this is what your brain was created to do, it's your central nervous system. Your amygdala is just trying to protect you. Thank you, amygdala. So I've taught people, let's thank your amygdala, let's lean into it, and just kind of remove a little bit of that fear, like there's something wrong with me. And yeah, so peer support group. I think we had your group was like you said you had 6 people coming, like a group of that was here tonight. So that's helpful. Also be able to share this helped for me, this or supporting one another, someone you can reach out to that knows what you're going through and can help you through help each other through any anxiety or panic attacks. Helps you feel less isolated. Psychoeducation empowers. Helps you feel more in control. So, we have a case study. Anna, 34-year-old woman, she experienced multiple ER visits for chest pain and dizziness. Medical testing ruled out cardiac issues, so we checked heart first. And I do have a lot of people I work with that have gone to emergency room because they thought they were having a heart attack, only to find out that it was anxiety. So after they ruled out the any cardiac issues, she was referred to therapy where she was diagnosed with panic disorder. For CBT, she learned to tolerate and reframe her symptoms. She began driving again and returned to work. So that just an example of what's the importance of proper diagnosis and tailoring the treatment to that person's experience. Yes. So, thank you. I meant to expand on that. Cognitive behavioral therapy. So if you think of like a triangle, I CT triangle up here. So cognitive are cognitions and thought, behaviors, and emotions. They're all kind of tied together. So sometimes it's kind of like looking first the chicken or the egg. So it might be you have a thought come, and then something that's fearful and is scary. So that triggers fear. So then I got the emotional part, and then that drives the behavior of I can't go to sleep tonight because I'm fearful and I'm having a panic attack. So and it all kind of works together hand in hand. So or sometimes people have an experience, a near car accident. It put fear in them, and then all of a sudden the thoughts, I'm gonna get in a car accident and I don't want to drive or a lot of fear. So that's what CBT is. It helps a person explore their thought patterns, and usually you can trace a lot of thought patterns like to a person's life, and then what it said here, like reframing them, like what Anna did here, reframe them. So when I was having thoughts of I don't know if I can speak in public, that's really scary. What if I mess up? What if I make what if my big presentation looks stupid? Then I was like, I studied hard. I'm not perfect. I don't know it all. But I have experiences. I've been through my own healing journey, and that joy to be able to share that with other people, like, so outweighs that. So that was the way I was able to reframe it. Yes, the racing heart still showed up. I was doing some deep breathing. I did 5, 4, 3, 2, 1 before I got up here. I actually thought I was going to freeze, and I didn't think any words were going to come out. And Lori said, "Here." I was like, "Hi." So I'm really thankful that all my tools work. I'm like, if anything, I will just give the people a realistic experience of what a panic attack looks like. And I know my friend back there would jump in and just give it a great speech and cover for me. So. Thank you. I hope that this, we learn. It's a whole new experience, and we can take that experience into the next one. So, like, if I have an opportunity to do this again, I'll be like, I did it. I breathed through it. So then the fear lessens. So I knew that I have to face it. I have to lean into it, and it helps me grow as a person. It helps me help others too. I can be like, hey, I did it. I get that public speaking stuff. How to support someone when someone is experiencing a panic attack. Your calm presence is crucial. So this is kind of like as a marriage family therapist where I look at those interactions between family members and couples. Are you throwing fuel on the fire and setting a dumpster on fire and rolling it down the hill for the person, or are you bringing a calm presence and just giving them the space to feel what they feel? So avoid dismissing or minimizing their feelings. Instead, validate their experiences, guide them in breathing techniques. Thank you. bring up a guiding and breathing technique from the first step. And avoid reinforcing the avoidance behaviors. So if you start using phrases like that dismiss or invalidate those experiences, then that just kind of keeps the person in the avoidance, or like a judgment, like it's not you, then that keeps them in that state of anxiety and panic. So just help them ground with deep breathing. Carry that hand of what I gave you, pull it out of your purse or your back pocket, be like, I got you. Also encourage them to seek professional support. So over time, reassurance paired with coping tools can reduce the intensity and the frequency. So just to summarize, anxiety is common and treatable. Panic attacks are frightening, but not life-threatening. The cycle of panic disorder involves fear of fear. CBT and exposure-based treatments are highly effective. Lifestyle supports and validation make a huge difference. Your awareness and knowledge can directly help someone access and feel less. And this is my references of peer-reviewed articles, evidence-based articles that I used to put this presentation together. And the resources in the back, which you've already found, and any questions, comments, sharing of experiences. Yeah, that amygdala's job is to protect you and to alert you when there's danger. That is one of the ways as well. Yep, yep. I specialize in trauma, and another great therapy technique that I use, and I'm using it a lot right now, is EMDR. Um, I have a lot of PTSD. I've used EMDR as well, and it was huge. Because I was over my trauma here, like I was in the past, but everything in my central nervous system and my body was like here, 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 and I couldn't understand why. Well, the EMDR, and that's probably a whole nother presentation, kind of turns off the alarm system and kind of connects the rational part of your brain to the emotional part of the brain, and they start talking to each other. So CBT does that too, where the thoughts are driving the feelings and the behavior. So we reframe the thoughts, help turn off that alarm system, or desensitize it a little bit, not make it so sensitive. Um, and then that helps relieve the symptoms. And then you get tools, like I said, never get rid of the anxiety, we just learn to manage it. Then you have the tools to manage it. So you can kind of stay within your what we call window of tolerance. A little anxious, but you don't want to get way up here, but then you don't want to be, emotionally numb or we dissociate. That's another one that people, it's easy to know when, you're having a panic attack or you got all these symptoms, but also another trauma response, or if you're experiencing a lot of anxiety, your brain just kind of checks out and just, it's called dissociation, kind of like disconnected from your body. Like you're still going, you're aware, you're still going through life, but you're just emotionally numb. Like you're just numb because your brain's just overwhelmed from all that anxiety. It's just another way for your brain to protect you. So we want to get all those parts in the brain, start talking to each other, and calm them down a little bit, so to speak. EMDR, eye movement, desensitization, reprocessing. So you know what REM sleep is when your eyes. So in REM sleep, that's when our brain heals. That's when we sleep and we get into REM sleep because we're sleeping well. The brain processes everything from the day, and it takes it from short-term memory. Okay, you dealt with this, and puts it into long-term memory. Well, when trauma happens, your brain can't figure out what happened. Like, how do I process this? So the trauma gets stuck in the front, like the short-term memory. So that's why the amygdala is constantly believing that you're in fight or flight, there's danger. Even if your eyes and your rational part of your mind is like, there's no danger, it's still kind of stuck. So what EMDR does, it goes through a process of finding target memories and pair them with feelings and body sensations, do the fast eye movements while you're bringing up the emotions and the memories, and it allows the brain to process it and put it back into long-term memory, where you still remember the trauma, but it doesn't have any power anymore. It loses all its power. And then all the fight or flight or the hypervigilance and all our survival skills that we teach ourselves while experiencing trauma to survive. And go to the side and you can start living life. Sure. Mhm. This is what I absolutely love about EMDR. Um, you don't have to sit there and rehash a trauma over and over and over again. We just kind of explore experiences I've had. EMDR works for traumatic birth experiences for babies who can't remember. There are people that born with anxiety and PTSD because of a traumatic birth experience. You're in the womb. Your central nervous system is developing in your mother's womb. If there's high anxiety, we have generational trauma. There's high anxiety while in the womb while your brain's developing. So there's a high risk of there being trauma, developmental trauma is what it's called. How we broke apart anxiety, we have different trauma, developmental trauma, um, you know, big traumas like a car accident, childhood trauma, so those also get broken down. So I actually worked with someone who I did EMDR, but she was adopted, um, and she knew that there was some trauma. She couldn't remember anything, and she had like she didn't. You don't have to understand what's going on, but she had like visualizing these purple and pink colors swirling, and I was like, maybe you're in the womb, like maybe that's like your brain because your body holds on to trauma. So like you experience it, you won't remember it, but it stays in that leaves an imprint. It leaves an imprint in your DNA. It doesn't change your DNA. It's not permanent, but it leaves an impression in your DNA. So that's why a lot of people might be living in a state of trauma response and just not know. And that's what being trauma informed therapist. I have training, further training, a lot of training on recognizing like this is a trauma response. Let's look into this and see where it's coming from. So no, you don't have to sit there and talk about. You don't even have to tell the therapist like what memories are coming up. You can do the eye movement that people tell me like, yep, something came up. I don't want to talk about it. I'm like, okay, good. And then you can also go by the sensations. There's people who don't have words because being a child, you might not have words to express what you went through. And as an adult, they just know they have these feelings in their body. I've had people like start with the pain here, and we're doing EMDR, and all of a sudden the pain was down here, and then it's gone, and they never experience that pain anymore. So they even a lot of relief from physical pain as well, because all of that traumatic emotions get trapped in the body. Yes, and I'm sorry I went on to trauma. Mhm. That's probably the level of heart palpitations. Like, just from my own experience, like the biological part, I think you're probably better versed in that area. And like the being a nurse. I love working, like, if people share with me, like, this is what the doctor said. It just makes me so much better because I can only cover one area. I really like that holistic approach. Like, so but I would guess the heart palpitations and people like I'm gonna have a heart attack. They think they're having a heart attack, and just recently a new person I started working with that's women, was living life fine, 35 years old, ended up in the emergency room. It just a lot of anxiety and depression, and it caused him to stop and think, I gotta stop shoving it under the rug, and I gotta face this stuff. So sometimes, trauma triggers, they're just little, they're red flags. Even that anxiety, those are red flags. Your body is telling you, hey, help me. Triggers are just little flags. Hey, something's wrong. This is an unhealed part. Let's work on it. And that's why people are like, I keep getting triggered. I keep getting triggered because it's your body telling you, hey, I want to heal. I need healing. Yeah. Two vitamins to sleep better. Mm-hmm. Yeah, I mean, there's lots of natural things out there, and that would be a good question for a doctor. If there's sleep medications. I know a lot of people use melatonin. I always tell people, go to your doctor, tell them to take some blood, check your vitamins, check your minerals, magnesium that relaxes your body. Anybody else have anything that they do? Ashwagandha. Yep. Yeah. Yeah.
And you can look it up on the internet, it has magnesium citrate, magnesium oxalate, they have magnesium.
Yeah.
Whatever supposed to be to
Yep, there's some magnesium for anxiety, some for sleep, and you can go to Walgreens and even ask the pharmacist, I'm looking for a vitamin or supplement of magnesium to help me sleep, and they'll even kind of help you pinpoint which one. Yeah. 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 I always say ask. Here's some things I've heard and used, but ask a doctor because it depends on everybody's, whatever other health issues they have going on too, and mix stuff. I can help with the emotional and mental part, but the physical part, I like having information about it, but I leave that to the doctor.
what is the max way just somebody that they have it that they need to that's they're like it's not or not like
Mm-hmm.
how do you
Here's my trick. It works, and I've been telling all my clients use it. They have family members, struggling. The power of curiosity, right? Because when you come at people like, you know, you have anxiety, you need help. What happens? Their defenses go up, and they're like, I don't want to hear anything you say. So this kind of being curious, like, oh, you haven't slept a lot. Have you been sleeping well? Or, you know, are you feeling okay? Just coming from a place of compassion and curiosity. And always coming from that place, one to come in compassion and love and empathy, they're a little bit more open, to hearing what you have to showing that you care. And I always tell people that person that comes to therapy, they need to be ready. So I get a lot of kids from parents here, fix my pain, fix my kid, fix my husband, fix my wife, and that doesn't work. So I always ask them, like, do you want to be here? No? Okay. Well, this happened to my former supervisor where I worked at. A mom dropped her teenage son off. He walks in, he's like looking around, and she's like, hi. He's like, what am I here for? And she, the mom, dropped him off and just left. And he had an appointment. And she's like, oh, this is, therapy. I'm a therapist. And she's like, do you want to be here? And he's like, no. He's like, okay. She goes, I can call your mom, come pick you up, or you can sit here for the hour on my couch and wait for her to come back. And he's like, I'll stay here and sit on the couch. And he played on his phone and mentioned his son again. So I'm sure he's pretty upset, you know. And it's always important for the person to be ready. And sometimes it's hard to watch people kind of go through the struggles and wait until they get to that point where they feel like, hey, maybe I need some help.
How does express manifest itself? Like how
Trauma, well, it would show up as trauma symptoms, which anxiety can be one of them, flashbacks, just not getting your, let me pull up, I don't miss anything, like common trauma symptoms. So like flashbacks, nightmares, even severe anxiety, uncontrollable thoughts about traumatic events, other common symptoms, avoidance of reminders, negative changes in mood, heightened emotional reaction. So this person, like people might be like just a very irritable person, difficulty sleeping, but it might just be a very, irritable, moody person that's constantly feeling bothered and just doesn't know why, you know. So I do have some people that come like, I'm just depressed, I don't know why, you know. So what we do, we explore it together to help them figure out why. Any other questions, comments, sharing of experience? Well, thank you. I appreciate you guys coming.
Well, we've just got some time here, a little bit. We've got some refreshments back there. Any questions you have, and maybe Erin, you want to